Hi everyone, so today we'll learn about the clavicle. It is the first bone to start ossifying in our body and it is the only long bone that lies horizontally. It has three major parts, the medial end, the lateral end and the shaft. Moving on to the side determination, we have three important points to note. That is, the medial end is large and quadrilateral, the lateral end is flattened and the shaft is curved convex in the medial 2/3 and concave in the lateral 1/3, and the inferior surface contain a groove in the middle 1/3. So this is the left clavicle. Moving on to the features, the shaft has two parts, that is the medial 2/3 and the lateral 1/3. The lateral 1/3 has two borders, that is the anterior border and the posterior border, and two surfaces, that is the superior surface and the inferior surface. The elevation present on the inferior surface is called the conoid tubercle and the ridge continuing from it is called the trapezoid ridge. Now the medial 2/3 of the shaft is rounded and it has four surfaces, that is the anterior, posterior, superior and inferior, and the medial part of the inferior surface contain a rough oval impression, that is of the costoclavicular ligament, and the lateral part contain the subclavian groove with the nutrient foramen. The medial end articulates with the clavicular notch of the manubrium and the lateral end articulates with the acromion process of the scapula. Moving to the attachments, the lateral 1/3 of the shaft has anterior and posterior border. The anterior border gives the origin of the deltoid muscle and the posterior border gives the insertion of the trapezius, and the conoid tubercle and the trapezoid ridge gives attachment to the costoclavicular ligament. The anterior surface of the medial 2/3 of the shaft gives origin to the pectoralis major muscles, and the rough superior surface gives the origin of the clavicular head of sternocleidomastoid. The subclavian groove has the insertion of the subclavius muscles and its margin has the attachment of the clavipectoral fascia. The rough oval impression on the inferior surface gives the attachment to the costoclavicular ligament. The most common cause of the fracture of the clavicle, it is due to falling on an outstretched hand, and the most common site is the junction between the two curvatures and it is the weakest point.